Hello, this is Debbie Lynn Toomey, Tufts Medical Center's Injury Prevention Coordinator, and you are watching Aging Strong, which is sponsored by the Quincy Health Department. Today's guest speaker is Dr. Natalia Yakutovich, and she is a chiropractor. And been so wanting to have a chiropractor come on the program here to kind of talk about fall prevention through their lens and also what they've been experiencing. So, Dr. Natalia, I think you said I can call you Dr. Natalia. Welcome. And I know you have a presentation for us. As you're pulling up the presentation, can you just kind of share with us a little bit about, how you got into chiropractic work?
Sure. So thank you for having me. I'm really excited to be with you on the air, so to speak. So yes, let me pull up, and actually the first slide of my presentation actually talks a little bit about me. So let's see. So yes, so what got me into chiropractic is when I was an undergraduate student at the College of the Holy Cross in Worcester, I ended up being rear-ended during my junior year. So at the time, I suffered from a whiplash injury, and I didn't know anything about chiropractic care. And someone suggested that I should go see a chiropractor. So I went, and it was just like so fascinating to me. And the fact that obviously the results worked because, I didn't have headaches, I didn't have neck pain that I originally presented with as a result of my car accident. So it was just so fascinating to me. And at the time, I was actually a pre-med student because I always wanted to be in healthcare, I wanted to be in medicine, I wanted to help people. And I decided, I was like, well, let's look into chiropractic. Like, how does one become a chiropractor? Like, where do you go? What do you do? And so I researched that, and I just realized that it just agrees with me so much more. And because I was a pre-med student already, I had all the requirements to get into chiropractic college. So following my graduation from Holy Cross, I went to University of Bridgeport in Bridgeport, Connecticut, and that's where I obtained my chiropractic degree. And I've been in practice ever since. So this was close to 19 years ago now that I've been in private practice. So I spent most of my career in Rhode Island. That's where I was practicing for the past 18 years. And recently I moved from Rhode Island to Massachusetts. And so I'm practicing now in Mass. And my philosophy and what I enjoy when it comes to chiropractic care is I try to incorporate nutrition, exercise, lifestyle recommendations, and even orthotics in the treatments, because we like to look at the person as a whole. So not only what's going on with their spine or their joints, but also are their feet supported? Are they lacking certain nutrients? How are they eating? How are they sleeping? And what are they doing? So that's kind of what I do. And I work with patients of all ages, from babies to very elderly people, and I really enjoy working with the elderly. And the oldest patient that I've ever worked with is 102 years.
Wow, 102 years old. My goodness, that's wonderful.
Yes. Yes.
Wonderful. Wow,
So
fascinating, fascinating. I can't wait to learn more about fall prevention from you then.
yes. So what happens is, and the reason why we like to talk about it is, yes, from a chiropractic perspective, and you'll see it's a little bit more than just, securing rugs and getting rid of cords. Obviously, as we age, unfortunately, time takes toll on our body. And so our balance and coordination start getting affected. What happens also, the hearing and the eyesight get worse, and that's going to affect, obviously, your coordination as well. Statistically, people with hearing loss are 3 times as likely to fall compared to those who don't have hearing loss, as well as people with vision impairment are almost twice as likely to fall. So the nerves that carry information from your brain to your muscles may also fray and deteriorate as part of a normal aging process. This will slow your reaction time, and it's going to make more difficult for you to move away from uncommon situations like people approaching you, or even adjusting to things like icy patches on the sidewalk or something being under your feet. So we also suffer from normal declines in muscle strength and joint flexibility. that's obviously going to affect your ability to stand, walk, rise from chairs, and it's going to can make you, easily lose balance and fall as well. 14 million, or 1 in 4 of adults over 65 years of age, report falling each year. And falls are the leading cause, actually, of fatal and non-fatal injuries among older adults. Emergency departments reported over 3 million visits due to falls in 2021. So it is a big issue in the older population. So many falls and fall-related injuries are preventable, though. So at least 1/3 of falls involve hazards within the home. And the most common thing, of course, is people trip over objects on the floor. So many times I've seen patients who tripped over their cat. That's actually one of the most common things that I've seen patients come for. I tripped over my cat, I lost balance, I fell, I hurt my back, I hurt my head, I hit the table. Sometimes not a big deal. Sometimes I've seen patients who've suffered actually, quite serious injuries as a result of tripping over their cats or dogs or anything. So for that matter. So do you have any questions at this point?
No, I'm just very the number 3 million
Yes.
visits after that's COVID time. So it's just really amazing and wonder like, wow, could it be the contributing factor being social isolation, you think, and people just kind of being everybody's routine was, basically upside down during nighttime.
Right.
Yeah.
Yeah, it's possible that it's due to the fact that everyone stayed home more and the elderly people were more isolated than even the rest of us. But this is the statistics from CDC. I couldn't find any years beyond 2021, like the latest years, because I was looking for like 2024, 2023. So there was only 2021. So I wonder now myself whether like this number is still up or a little lower. So yeah, it's very possible that this was more pandemic related. But even just in general, the fact that 1 in 4 adults, report falling each year. So, and obviously now, as you know, when you go to your primary care doctor, they do ask everyone, have you had any falls within the past year? Are you at risk for falling? Do you feel unsteady? Like I went for my physical recently and they gave me this questionnaire. So they screen everyone now, which is good.
That's very, very good. And I still think that number 1 in 4 is, I'd say the ratio is much higher because this is based on what's being reported.
Right.
And not actually what's happening, because some people tend to fall, but because that's become a routine part of their day, they don't consider that as an incident or an occurrence, but rather, they caught themselves, or just maybe the definition of falling. Some people feel that, the definition of falling is you have to hit the ground and there's bleeding involved or bruising involved, but that's not necessarily so.
Correct. Yes. It's not well defined. What does it mean? Yes. And I've seen patients like that as well that fall literally like every other day, and to them it's part of their normal life. Yeah. And they're like, yeah, I have a bruise, no big deal, whatever, another bruise. Yeah. They're like, as long as I'm alive, it's okay.
Yeah.
So, so first off, obviously we start off always with a, home safety checklist, which is the most basic thing. Is like, okay, you have to evaluate your living space. Obviously it seems very common sense, but, unfortunately, things like this still need to be taken care of. So you want to remove, things that are loose, obviously, on the floor, like, like area rugs, throw rugs, even in the bathroom, those, bathroom rugs that we have, it's very easy to trip over them in a small space and fall and, hit yourself on the bathtub or a toilet. Secure carpet edges. Even in my own house, we have this one area where, everyone keeps tripping over because the carpet is just, bending just so. And I'm like, we got to secure that. We got to tape it down so no one goes flying. Remove low furniture and objects on the floor. Yes, you want to remove things that are low to the floor, clear that space. So you're not gonna hit anything. Reduce clutter. I mean, it's always good to reduce clutter in general. Remove cords and wires on the floor. So, chargers, things, have someone, make it so that way it runs along the perimeter of a wall, not across the middle of a room. So that way, you're less likely to trip over a cord. Make sure you have adequate lighting at night, especially along the path to the bathroom. Very important. Okay, so have night lights. Okay, have some sort of light somewhere so you can see where you're going in the dark. Because in the dark, as you know, obviously things look different, especially when you're half asleep. So yes, so secure the carpet or treads on stairs. If you don't, if you have stairs and they're, let's say, wood stairs, consider even having those little, runners or little things that can be installed so that way make those stairs non-slippery. Handrails, same thing. Make sure that there are handrails on the staircase so you can have something to hold on to. Periodically have them checked, make sure that they are attached securely, don't get loose. Eliminate chairs that are too low to sit in and get out of easily. A lot of times patients ask me questions even on furniture, like, hey, I need a new couch or a chair. What would you recommend? I always tell them that I need something that's easy to get in and get out of, that, and something that's firm, that you're not going to sink into that couch or that chair, because it's going to be way harder for you to get out of that chair. So don't wax your floors or use non-skid wax, okay? And obviously also along with the waxing and everything else, make sure that you wear slippers that are not slippery. So not wearing, don't wear socks or barefoot, wear actual shoes like sneaker, something that's not slippery and that's not going to slide off your foot easily, because sometimes, again, patients come in, they tripped over their own slipper because the slipper slipped off their foot and now they fell down the stairs. Ensure, and make sure that the telephone can be reached from the floor. Consider getting the medical alert button. So if it's someone who is at high risk for falls, they should have a button or some sort of an alert on them. So that way, if they hit the floor, it gets activated, or they can push and someone will come and help them. So that's the most basic safety checklist. And of course, the bathrooms, obviously install, have someone install grab bars in the bathtub, shower, and by the toilet. Use rubber mats to make the bathtub or shower non-slippery. And again, take up those floor mats when you're not using the bathroom, so that way you're less likely to trip over them. And install a raised toilet seat, or have even install the arm supports that can go over the toilet to help you get off the toilet easier. Outdoors, very important. Repair cracked sidewalks, right? Very easy to trip, get your heel stuck in there, anything. Install handrails on stairs outside, of course, and steps. Have someone trim the shrubbery along the path, get rid of the weeds, especially if they're long. They're very easy to trip over them. And again, the most basic thing, have adequate lighting by the doorways, along walkways leading to the doors. There are all these little solar lights and all kinds of things one can buy that are not expensive, that provide enough lighting along the path to your home. So the other important thing is, falls oftentimes are due to certain medications that we take, right? So it's very important to make sure that you review the medications with your physician, because many medications have side effects that can affect your brain function and lead to dizziness or lightheadedness. Of course, taking multiple medications that have all kinds of effects that when they interact together can increase that risk, as well as combining prescription medication with drinking alcohol, over-the-counter allergy pills, sleeping medications, painkillers, or even cough syrups. So very important to review all of that. And of course, very important, which not a lot of people like doing, but discuss the need for walking aids or supports that while taking medications that can affect balance. A lot of times I've had patients come who know that they may need a walker or a cane, but they don't want to have one because they feel like, it will make them look old, and then people feel like, I don't want to look like that. But you have to realistically consider and talk with a physician about those things. Any questions at the moment?
No, you're covering a lot of great content here. Just again, these are a lot of things that people need to kind of be reminded of and also if this is new information, these are just really valuable information. If you need to watch the recording of this show, because there's a lot of information that's being shared here. And as you're talking, I can't help think about when I do workshops for the older adults, and also for my mom, just kind of, looking at her environment and making sure that everything is as safe as possible. Yeah.
Absolutely. So yeah, and again, it's like things that we see every day in our practices. So, that's why I mentioned these things, like someone's, slipper slipping off and falling, or tripping over something, or even medications. I've had so many times elderly taking like 10 different medications that, dizziness and loss of balance is one of the most common side effects. And unfortunately, it's hard to tell, what's doing it or what medication is doing. So then it's like, okay, you can't get off of this medicine, but let's try and take some preventative steps then, to reduce the risk of falling. So have your vision checked. Again, going back to the whole eyesight, reduced vision increases the risk of falls. Age-related vision diseases, including cataracts, glaucoma, they can alter your depth perception, your visual acuity, and susceptibility to glare. So that's going to affect how you move, obviously, in a safe way. And so it is very important to have regular checkups with your eye doctor. And the other thing is, which again, some people forget to do, is actually clean your glasses to improve visibility. Again, I've seen people come in, for appointments, and then glasses are dirty. And I'm like, how can you see? They're dirty. Like, when was the last time you cleaned them? Like, here, take a tissue, wipe them. It's as simple as that sometimes, right? And it seems like it's self-explanatory, but again, it's easy to forget. The other big thing with falls is that, the fear of falling a lot of times is due to having osteoporosis, which is obviously very common as we age, or having brittle bones. So osteoporosis makes bones obviously less resistant to stress and more likely to break. And it could be due to many things. It could be due to hormonal changes. Medications, again, can cause this, calcium and vitamin D deficiency, and even decrease in physical activity. So, and it is one of the leading causes of fractures in older adults, especially women, once they go through menopause. So, what do we do? How, and how can we then help this situation? So obviously we want to make sure that we eat and drink enough sufficient calcium-rich foods. And, dairy products, fish, shellfish, broccoli, soybeans, collard greens, turnip greens, tofu, almonds, kale, all those great things, which are like really good for you anyways, but also have calcium. Eggs are also a great source of calcium. And of course, we want to make sure that our vitamin D level is sufficient to help us absorb that calcium into the bloodstream. Normally, vitamin D, is produced in the body naturally after, exposure to sunlight. But as we age, the skin's elasticity changes, so we don't absorb it as well. So, older adults a lot of times need to supplement due to lower production of vitamin D in the body. So we want to, again, make someone feel stronger so they're not afraid and less likely to fall. So, and we'll go through even, what do we do, how do we do this? So how do we, how can we help someone, feel a little bit stronger and more balanced is, obviously suggesting exercise. And consider incorporating exercise into your daily routine to help improve balance, coordination, strength, and flexibility. So most healthcare professionals recommend at least 20 to 30 minutes of exercise 3 to 4 times a week to help improve endurance, and it can even help lose weight. So obviously, before we begin any kind of exercising program, whatever it may be, you got to check with your physician, whether it's your primary care, chiropractor, or whoever else you see, to make sure that, you are in the shape to undertake that particular activity. So I just listed, a few examples of certain activities and even how many calories, you burn. So water therapy, always a great thing, especially for someone who may have joint problems like back pain, hip issues, like even walking in a shallow pool, which will be, amazing. Swimming, water aerobics. For some people, it might be a little bit too much, again, depending on what they have going on or if they have breathing issues and such. But even like I said, walking in a shallow pool will be great, okay? Walking in general is good. The American Heart Association recommends 10,000 steps a day to an adult. Obviously, as one gets older, it might be difficult to achieve. So, even if you get 2,000 steps, it's better than no steps. Obviously, it's better to walk on a surface that's a little bit softer rather than asphalt or uneven terrain. So, but I know it's not always possible to walk on grass or sand, depending on where you live. And stationary recumbent bike, again, great form of cardio, which is not strenuous for your back. And we're actually pretty gentle on the joints, and you actually burn, 250 calories, which is, not bad at all. So walking, of course, improves elasticity in our blood vessels. It's good for everything. Start with at least a third of a mile per day. You can do 1/6 one way up and 1/6 back. You can measure the distance with your car, or if you have a smartwatch or phone, there are apps for all those things to track your steps and distance. Do that 3 days a week for a month, then double the distance, working gradually up to at least 1 mile a day, 3 days a week. That would be my recommendation. So of course, a little bit of soreness is normal. But if you experience more than soreness, if all of a sudden, have a lot of leg problems, or all of a sudden back starts hurting you, or your feet or something, see a chiropractor. That's what we're here for, to see what you have going on and figure that out. Stretching is also very important. I usually give to most of my patients stretches to do at home. A lot of people know what to do, but sometimes they need a little bit of a reminder. So I do like to give them some gentle stretches to do. Just, it feels good to do. It helps support, what we do, but also prevents, kind of bowing or looking down and stooping. So, and a stoop is obviously going to affect the ability to breathe, but also you're not going to be able to see when you're walking ahead of you. If you have a tendency to look down, you're just going to see pretty much what's, near your feet, but not ahead. So you're not necessarily going to be aware as well of your environment if you're just looking like down in one spot, and that's going to also contribute to risk of falling. Proper nutrition. Make sure that you have a properly balanced diet. If you take vitamins, please make sure you have them checked by your healthcare provider to make sure you take what you need to, that it doesn't interfere with your medication. And you have to drink a lot of water to help remove toxins and obviously replace lost fluids, especially if you're sweating. Coffee, tea, all those other fun drinks, they're not, same thing as water. A lot of them are diuretics. They actually will make you more dehydrated. Again, as part of even chiropractic evaluation, we always ask new patients, like, well, how much water do you drink? Or what do you drink in general? Because again, older people tend to drink, I find, more coffee and tea and less water because it doesn't taste good. It's not interesting. So, and they're just used to having coffee and tea, but it's like, okay, you can't have coffee all day or tea all day. We need some water, and even for those muscles to work, or if you have soreness after walking or stretching, you need some water and not coffee, right? Makes sense?
Yeah. Yeah. Can you explain a little bit about bowing? I can understand what stooping.
Right. So, kind of same thing, bowing, like especially increased, curvature of that upper back, almost like, some people even develop developing like a hump type of situation because the ligaments become shortened. We end up having hypertrophy of the ligaments that connect your spine. We started going through, wear and tear, degeneration of the spine. So it causes that, bowing type of a situation, which is pretty much similar to stoop. It's just another word for it.
Oh, okay. Yeah. Okay. So is that what people would say, almost like a text neck? Is that where that term, when people are texting too much?
Yeah, text neck. Well, I guess if they're gonna text like this their whole life, by the time they're like 70, they're gonna end up being stuck in that bowing position. Yeah, eventually. I mean, generally with the text necks, they just have that, protrusion going on initially. You're not necessarily bowing. They just like their head sticks forward. Yes, in the younger people. Yeah. But eventually they can get, stuck like that.
Yeah.
Which is something we'll work on to, trying to help people prevent that. Okay, so how can chiropractic care help? So what happens is we have something called proprioception. Proprioception is your body's ability to sense its position and movement in space without relying on vision. Like, how do we know that we're upright, that we're not falling over? Okay, we have something called proprioception. It's these sensory receptors. They're located in our muscles, joints, tendons. They send signal to your brain, okay, about the position and movement of our body, okay? So that's how we rely on, for that, on balance, right? So if I'm standing upright, I'm constantly getting feedback from my feet, actually, up my spine, to my brain, through my neck. So that way I know I'm upright, I'm not falling, I'm firmly planted, and I'm, standing. So what happens is the feet are very, very important in this particular situation, okay? So the ankle-foot complex is a key area for proprioception, as it's the primary point of contact with the ground, okay, during most activities. So proprioceptors in the feet and ankles constantly send that information to the brain about the body's position and movement, so that way we can continuously maintain balance. We're not falling over, okay? what happens is as we get older, those sensors in the feet start deteriorating. Okay. So our ability to sense even touch or, have that sensation under our feet decreases. Okay. As well as, the nerves that carry signals from your spinal cord, up to your brain, they also start deteriorating as we get older. Okay. As well as if we have some degenerative changes or wear and tear happening at the neck level, because neck is also crucial in this case. Okay. That if we have this as a combined effect, so now our body is not doing that good of a job of, relying on these proprioceptors because these proprioceptors are deteriorating. Okay. So as you see, you're more likely then to start shuffling when you're walking, looking down more because you lost that ability to really have that proper feedback from the feet all the way up to the brain as you get older. So, of course, we can't obviously reverse aging and all those things. However, we'll look at, as chiropractors, at the feet and the ankles and try to improve the joint mobility and proprioception as much as we can through an alignment or an adjustment. And we improve how the signals travel to your brain when we adjust that particular joint. Okay. So as a result, we improve that feedback, which leads to obviously better balance and coordination and can help us reduce the risk of falls. The other big thing is I always look at the shoes that, the patients come in and that they wear, because footwear is very important for the proprioception, as well as we screen for flat feet or arch problems and correct them with custom-made inserts for shoes, okay, which can also improve that proprioception from the feet up to the brain. And honestly, majority of a population, adult population, have some sort of arch issues. It's very rare that we see someone who doesn't have an issue with their arches, whether too high of an arch, too low of an arch, rigid arch, various things, okay? So pretty much almost everyone needs some sort of an orthotic. Obviously, the best kind of the kind that are made specifically to one's feet to address for those specific nuances. So, and literally there are studies that have been made that show that, yes, when you wear orthotics, it improves the proprioception and it helps you with your balance. So, and so yeah, I absolutely love even myself wearing orthotics. I feel more supported and more planted when I wear them.
Does that pretty much help the posture too with?
Yes, correct. Yes. So same thing, from your feet all the way up. So because it will affect the biomechanics of your ankle, your knee, your hip, all the way up your spine. So yes, actually when our feet are more supported and we're more balanced, our posture actually naturally improves. I've had a lot of patients who tell me, like, I noticed that when I stand or sit, I feel more upright. I'm not as hunched over. I feel more balanced. And, seriously, it's one of the really beautiful side effects of even coming for chiropractic care.
No, so that's very fascinating. So two questions pop into my mind. What about diabetics who have neuropathy?
Yes.
Tingling in their feet, not knowing, their proprioception must be thrown off.
Right, absolutely. Because of a numbness and tingling when they come in and say, like, oh, I can't feel my feet really well in the shoes and the toes. That's a very, big problem. So again, orthotics can help. Obviously, it's not going to get rid of a diabetic neuropathy or some of the numbness that's coming in because it's an internal problem, but we can still stimulate those proprioceptors as much as we can from the outside. Diabetics generally need a little bit more than just orthotics. They need and for neuropathies, they need more like, okay, hey, can we help you somehow from within with certain nutrients and nutrition to see if we can, help stimulate those nerve signals, like let's say certain even vitamins that are known to improve how the signals, travel down the nerve endings. But diabetics definitely benefit from orthotics. Obviously, some insurances, even as cover diabetic, shoes and inserts of things of that nature. Because most, health insurances don't cover these things unless someone has diabetes and diabetic neuropathy.
I can imagine how a team effort, as far as having a podiatrist who's really good about, keeping an eye on the nail care, making sure that they don't have ingrown toenails and there's no diabetic wounds that's happening, and then also having the appropriate inserts. So that way person is really, maximizing their foot care, you know?
Absolutely.
Yeah.
Yes. Yeah, absolutely. It's very important, for them to get proper care from a podiatrist, endocrinologist. Like, yeah, obviously, as you know, when someone has a metabolic, disease, it's a team effort.
Yeah.
Yeah.
One more question about the footwear. So we're going into the warmer months, and so inserts. What does that look like as far as when people start wearing flip-flops or
Right. So,
sandals?
so for flip-flop wearers, and I wish I had them here that I could show you on the screen, but I don't have it within my reach easily. But for flip-flops, they actually make them built into that, insole of the flip-flop, the actual arches. Okay, they're built in. If someone really wants to see what it looks like, you can go to the website called www.footlevelers.com. That's one word, foot levelers. So footlevelers.com. It's one of the orthotic companies that I absolutely personally love and I use for orthotics that makes custom orthotics. They also make sandals and flip-flops. Okay. So instead of a flat bottom that you have in your flip-flop, you will have, bumps for your arches in that flip-flop. They are super comfortable. I have a pair. My one of my kids has them. I mean, lots of patients have them. They come in fun colors. They're weather resistant. They're comfy. Again, for long distance walking and for exercise, obviously you're not going to wear flip-flops even with, proper support. You still need sneaker. But for warmer weather, yes, when you want to wear something else besides the sneaker, yes, they do make them in a flip-flop version. They make them in a sandal version. They make them even, how like Birkenstocks are popular. They have a Birkenstock looking like sandal. Obviously, it's not a Birkenstock. It just looks like, like that type of style sandal with those arches built in. Yeah. So there are alternatives. For shoes, it's usually an insert that goes in the shoe. In the shoe where the lining is removable, the lining usually, gets taken out and the insert, goes in place of that lining. And they're soft, they're comfortable, they're not plastic, they're leather, and they're very supportive. So
what are your thoughts about, when you go to a local pharmacy, it seems like you can get anything these days, right? You get glasses, reading glasses, you can have those little hearing aids, right? Groceries, you can get like inserts. What are your thoughts? Inserts that people would buy in the grocery store or
right. So yes, a lot of times, I've had patients come in and say like, hey, I went to CVS and, I got generic Dr. Scholl's things, or I went to Walmart, same thing. I got Dr. Scholl's thing. They even had some sort of a scanner machine. And so then it said, get, these ones. And I'm like, okay, for some people it may work. For most people, it won't work because they're not made specifically to your feet. They don't know what you have going on specifically. So it may not address your specific arch problems. Moreover, we have 3 arches in our foot, not 1, not 2. Most generic orthotics do not address all 3 arches. Okay. So that's the thing. And second of all, is telling like, okay, those things even at CVS, Walmart, they're not so cheap. So I would rather have you take that money, set it aside, and save it towards a better pair that's specifically made for you that will help your feet, be how they should be and help all of you and will feel actually comfortable and good.
Is it ever possible for one foot to require a slightly higher insert compared to the other foot? I mean,
correct. Yes. Okay. Yes. Because they're individually made. Yes. And as you know, nothing is perfectly symmetrical in our bodies. So same thing goes for our feet. So yes. And usually when I look at the feet, yes, same thing. One foot may be a little flatter, the other one is not. So one may need a little bit more than the other. That's correct. Yeah. Kind of like even with our spine, when things deteriorate in our spine, right? Like when we start having osteoarthritis in the joints of the spine. Let's say I've looked at, x-rays, MRIs. A lot of times it's not perfectly symmetrical. It may say like, or it may show like, oh, right side of the neck has a little more osteoarthritis in the joints than left side of the neck even.
Wow.
Yeah.
Makes sense. Makes sense.
It does. So, so as you see, and as we're talking about this, fall prevention requires like a pretty, multifaceted approach. It's not just simply as, going through a checklist and taking care of things at home or in the bathroom, but it's also like, hey, we need to work on getting you stronger, feeling you more, making you feel more balanced, making sure that you're properly hydrated, that you're eating things that you should be eating to give you that, endurance. And even making sure that your joints are aligned, whether it's feet, neck, back, addressing any kind of, issues such as back pain or hip pain that, may be happening that can affect your balance and coordination as well. So, so as you mentioned yourself, it's a team approach and usually involves more than just even seeing a chiropractor or even more than just seeing a primary care doctor.
Fascinating. Fascinating. So, are there any, you mentioned earlier, there's certain types of stretches or movements that you tend to share with older adults or people to kind of
Yes.
your clients or patients to help?
Yes. So, so sometimes it's as basic as like, hey, let's do some knee to chest pulls while lying in your bed in the morning and just gently pulling each knee towards you to just kind of loosen up your back, or even, stretching your feet in bed even before you get up, and stretching your kind of pointing your feet towards you to stretch the calf muscles, doing little seated neck stretches, range of motion exercises for the neck. Sometimes as simple as that. I always tell patients, even, shoulders, making sure that you move your shoulders, do shoulder circles. You don't realize that you lose some of the range of motion unless someone makes you, do some of those movements. And then you're like, wow, I can't really move my shoulder like that. And you don't know how long it's been like that. So that's why I'm like, movement is key. Keep those, joints as flexible as possible. And then, of course, if someone comes and says like, hey, I want to work on my balance specifically, depending on what they have going on, there are even exercises that I will show them like, okay, there's like little single leg stands where you kind of like lift one leg up and see if you can stand on one leg, in a safe and, way, holding on to something, making sure, you're not falling over. But can you stand on one leg? Just lift the other foot off the ground just a little bit. Can you stand on one leg even for 15 seconds, right? Without, being all shaky or falling over. So, and then you can build upon that. And there are little exercises that you can do improving that. But again, if there is a problem with a foot or the ankle, someone may have difficulty standing on that one leg because if they had ankle sprains, for example, or other injuries, that their ankle is unstable, they're gonna have trouble even doing that, lifting one foot off the ground. So then it's like, okay, you have to rehab your ankle and do some ankle strengthening exercises to get that ankle strong.
Yeah. I'm going to have you come off the screen share so people can see us as we continue to our conversation. And thank you so much for adding this slide. So for people
Yes.
who have more questions, this is Dr. Natalia's contact information located in Braintree, right?
Yes, correct.
Yep.
So you can find me at Whole Body Solutions in Braintree. So I'm there Monday, Wednesday, Friday. And then there's another chiropractor, the owner actually of the office, Dr. Ian Doggett. So, but there are other practitioners in the it's a multidisciplinary office. So there are other practitioners. So if someone has other types of questions or, other types of care that they may need, the office can address all those things.
Great.
All right, let me stop sharing.
All right. So more questions about older adults. So people are becoming, I feel, more open about getting chiropractic care. I was just talking with somebody today and they said, oh, yes, I've gone through 2 different types of chiropractors, which is great. And I feel like it's becoming more of a mainstream now. For people who are watching this program and have been kind of like, oh, curious. Now I want to see a chiropractor. And how do you see new clients, older adult, maybe female? You look at their history, they might have osteopenia or maybe osteoporosis. Do you have them go for an x-ray first before you start working with them, or how does that work? What does that look like for new patients?
So it depends on what they are coming in initially with. If they, let's say have, I don't know, terrible chronic lower back pain, usually, they do have some sort of an X-ray or an MRI that was done already if they have a history of long-standing problems. So usually they have that information that they can easily bring to us or we can obtain from whoever took that imaging or that X-ray or that MRI. a lot of times patients bring in the reports that, let's say they had a DEXA scan, that shows that they have osteoporosis or osteopenia. So they bring that report for us to see, which will be part of their record. So, we record that. For patients who, let's say, don't have specific complaints, but kind of like, hey, maybe I should see a chiropractor, see what I have going on. So depending on what I find, I may tell them like, hey, ask your PCP for a referral to get an x-ray, let's say of your lower back, or I may not. It just depends on what they have going on and what we find during the exam. So having osteoporosis or osteopenia is not necessarily a contraindication to chiropractic care. And for those who are even afraid of traditional manual type of adjustments, we have machines and tools that we can use instead of a manual adjustment. It makes it very gentle, very safe, very comfortable. That's why, like I said, my oldest patient was 102 years old, with very, bad osteoporosis, very fragile, but we could still safely treat her and get the results we're looking for because we have those other tools that are gentle on the bones. So the first visit, it depends. They may need x-rays, they may not. Sometimes what happens is they come in for that initial visit, and then I will tell them like, okay, based on my findings, I would like for you to contact your PCP and ask them to have the lower back x-rays done, let's say, or I may not. For older people, because obviously most of them usually have Medicare. Medicare requires a referral from PCP anyways, okay? So that's why I would tell them, okay, you're starting care here, but contact your PCP, ask them for a referral for an x-ray. So for people who don't have Medicare, and let's have some other type of private insurance or however they pay, usually there is no referral needed for those things. So it also depends on what insurance they have.
So Medicare patient, if they have an issue, get a referral from their PCP. But if they're a Medicare patient, they're just, maybe curious about, chiropractic care to maintain health and wellness, they can go by themselves without any type of referral. Okay,
correct.
Got it.
So Medicare does not require a referral to see a chiropractor. So anyone with Medicare can call up and say like, hey, I want to schedule a new patient appointment. Okay. It's a matter of like, if they require any kind of diagnostic testing, like x-rays, MRIs, etc., yes, then they need a referral from their primary.
And the chiropractic care, that's covered by Medicare. So it would be a copay that the person would pay for.
Right. So when it comes to Medicare specifically, not other types of insurance, but Medicare specifically, Medicare has very specific narrow set of rules when it comes to coverage of chiropractic care. Medicare covers chiropractic care, but unfortunately for only a limited number of visits. So because they consider chiropractic care like medically necessary only for like, let's say, initial 5-6 visits, and then they cut you off. Okay. So that's where there's a little bit of a situation there. If someone, let's say comes in and they're just overall for wellness here present to us, then that's not a problem. But if someone comes in and now like, okay, I have this long-standing lower back issue that may need more than 5 or 6 visits, it becomes a little bit of a, difficulty because then, Medicare may not cover their care long-term, and they will have to end up paying out of pocket, unfortunately. So it just depends on that. So that's how Medicare works specifically. It doesn't usually apply to other insurances. Other insurances have other rules.
Now, as far as patients that you feel have red flags, right? Maybe you mentioned car accidents. Somebody who had a car accident, they didn't go to the ER because they felt okay. The car was a little bit damaged, but they were fine. But then maybe a week later or a few days later, neck pain or low back pain or sciatica pain.
Right.
What do you, as a chiropractor, what do you usually suggest for these type of people? I mean, everybody can be different, right?
Right, of course. It depends on, the age of person, what they have going on, severity of symptoms, et cetera, et cetera. So for a lot of car accidents, then I will suggest to them again, hey, contact your PCP, get some x-rays done of neck, back, whatever area that you're coming in here for, just to rule out, things. So in terms of red flags, yes. So if it was a bad accident, but usually they end up going to the emergency room or get checked out if it was a bad accident. Obviously chiropractic care is not for everyone. So in terms of red flags, so for example, someone who has cancer that, spread to their bone, chiropractic would not be appropriate for those people. If obviously they have a healing fracture, let's say, I don't know, they fractured, their vertebra somehow, obviously we're not going to touch that area. If they have metal in their spine, let's say they had lower back surgery and they fused, a couple of their vertebrae. So the area where the metal is, we don't touch. So we avoid that. So we, let's say, treat the areas above the area of metal and the areas below the area of metal. So yes, so based on their history and what they come in with, when we have a conversation with them, a consultation, and we find out all these details, we determine, and I always tell the patient, like, hey, this is what you have. This is what I can do. This is what I can't touch, et cetera, et cetera. So yeah, but for majority of the population, chiropractic care can be a nice add-on and, very beneficial. And it's safe for pregnant women and obviously for little kids. And a lot of actually OBGYNs do recommend chiropractic care now to pregnant women. Because, pregnant women can't really do too much when they're pregnant and they can't take a lot of medication, obviously. So chiropractic provides a safer non-pharmacological alternative with, can be quite beneficial and provide relief that they're looking for.
And what type of ailments would that be? Like low back pain because of center of gravity being off?
Yeah, lower back pain, sciatica, babies pressing on the nerve, hip pain. That's usually the most common ones. Sometimes some women come in even during pregnancy, they develop carpal tunnel issues because of the swelling, of everything. So things of that nature.
Oh my goodness, I wish I knew this when I was pregnant.
I know, that's what a lot of people say.
I had such bad sciatica.
Yeah. Yeah, and it's safe for babies and little kids as well, and little kids and usually come in not because obviously they're back hurting, because it's not, but to come in for overall wellness, because obviously kids go through rapid growth stages and growth spurts, and want to make sure that they're growing as well and as healthy as possible. So sometimes they need little adjustments of the spine, nothing major, very gentle. So also with kids, depending on the age, like we'll look at the posture, see, okay, do they have posture issues? Do they need little exercises to help them correct the postural issues so that way they don't become bigger problems as they get older? See patients who have scoliosis. So then I give them exercises for even strengthening the muscles around their spine for, scoliosis. So things of that nature.
Wow. You mentioned babies. And so
Yeah.
how would a mother know that their baby would benefit from chiropractic care? Is it because they're not crawling, they're not meeting their milestones, or do they tend to do they notice the baby tends to favor one side? So what does that look like?
So usually with babies, what usually happens is either mother is an existing chiropractic patient, so she's like, "Hey, I want to bring my baby because I come here and I want them, to be checked out, just to make sure everything is good." Or if they're not a patient, then what happens is like, "Oh, my baby has torticollis, so they're always with their neck like this. So like, can we straighten out the neck, help them, to kind of straighten it out." Maybe not rolling over, or maybe they're not crawling, not walking, can you check, see how their hips are, their back, things of that nature.
So even like toddlers, when they start walking, some are walkers.
Yes,
Yeah.
toe walkers, yep.
Yeah.
So yeah, have seen those as well. Some are toe walkers, they grow out of it, some don't. So also for kids, as they get older, speaking of toe walking, again, evaluation of feet for orthotics. So yes, checking their feet, for adjustments, as well as the whole lower extremity and the spine, but also evaluate them as they get older for the need of inserts for their shoes. But a lot of times they also need other type of care. So like, for example, is something going on at the brain level, is it a habit? Is something happening? So kind of figure out what are those behavioral patterns due to. So it may require involvement of other types of providers.
Yeah.
But from a chiropractic standpoint, yes, looking at the feet, looking at the ankles, looking at the whole leg. Yeah, very important.
Yeah. Very interesting. Very interesting. So you also talked about, I'm taking notes here.
Hmm.
People fear of falling. Fear,
Right.
so going back to older adults, fear of
Yeah.
falling. I mean, that's a whole, they have an evidence-based exercise program called Matter of Balance that centers around people, changing that mindset of fearing that they might fall. So it's like an 8-week program. They start talking about different aspects that can kind of help a person become stronger and also mentally and
Mm,
um, how do you how does chiropractic work help reduce the fear of falling? Is it because of proper stance, better command of their body, being able to coordinate better? What does that look like as far as chiropractic's the contribution of that towards fall prevention and fear of falling?
right. So see, okay, right. So right, we want to figure out what was the fear of falling due to. Is it, right, like because of, yes, I have poor balance and when I lift the leg up, I fall over kind of thing. So from chiropractic standpoint, yes, we want to improve their strength and make them a little more flexible and also try to improve their strength. So like give them exercises even to do like, okay, for their legs, right? Like, hey, let's work on, strengthening your leg muscles, but at the same time checking, for issues at the hip, at the knee, at the foot, at the lower back level, right? So that way, okay, or are you afraid of falling because you have bad knees, right? So what do you have going on at the knee level, right? Is it osteoarthritis? Is it something else? Can I, make your knees more comfortable so you don't feel like, you're gonna fall because you have bad knees. So that's what it looks like. It's pretty much evaluating the spine, the whole lower extremity, looking, at the footwear. Again, I always look at everyone's shoes, and looking at the feet themselves.
Yeah, I love how you're assessing the patient from head to toe.
Yeah, you have to.
Yeah, it's just amazing. And if just the thought of you including footwear is just it makes sense. But it's just like something that I don't really, as somebody who does a fall prevention workshops, I would say, okay, it's recommended that people walk around with uh, backing on their heel. So that way you mentioned flip-flops, so that way you're not
Yeah,
tripping over, you're not kicking off your flip-flops or slippers or
right,
whatever. Um, but definitely there's a lot to be said with proper footwear, something that fits, something
right,
that, you don't want to really wear like a very, 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 very old footwear because then
um,
they're changing the heels, right? Just from the way,
right. Yes.
yeah.
Yes. People wear really old shoes, sometimes really worn out, which again reduces that support. Or like I said, just bad shoes in general, right? Like, again, I've seen older ladies who love wearing, little heels. Like they don't wear sneakers. They're like, I don't wear sneakers. I always wear a little heel, whether it's a wedge or loafer or whatever. Like, okay, this is great, except for, not very supportive. And let's say you're going to step outside and it's icy, it's not going to really help you in that situation. So even changing that mindset as to like, okay, we need to be more open to more supportive or other types of footwear, so having a conversation with a patient is very important.
Yeah. And if as far as the inserts go, I know it's an investment, but
Right.
they also wear through time, right? So when does somebody know that it's time for them to change their orthotics?
So most people get, 2 or 3 years out of them of like regular, consistent, almost like daily wear. So you get a lot of use out of them. Okay. So it's not like a short term or a quick thing that you're gonna wear through really quickly. Now, so I've had patients come in, their orthotics are 5 years old, they're still functioning, they're still wearing them, they're still getting support. Okay. It also depends on the individual's just how they wear their shoes, like, right, everyone wears out shoes differently. I've had some patients who wear out holes in their sneakers after 1 year, right? That's just how they if they're hard on their feet, so they may need orthotics sooner than maybe after a year. But generally it does not apply to the elderly people. The people who really wear their shoes really hard usually are the younger people who are working or have physical jobs. Older people generally don't have that, but I do see a lot of older people wearing really old shoes, and you can tell they're worn out. And it's kind of like, okay, first thing first, you just need to just buy a new pair of shoes, new pair of sneakers, even before thinking about orthotics. So yes, but easily get 3 years or more out of them in
And they're
terms of performance.
transferable pretty much, right? You can take them out and
Yeah.
put them in another. Okay.
Yeah. They're very easily removable, just like the inner lining of your sneaker, you can take it out, stick it into another pair of shoes and just go. And they make them for different types of shoes. So yes, so I have some older ladies who just love wearing their cute little booties and little shoes and don't want to wear a sneaker. So they do make them even for those dress type of shoes, slightly different construction, but they do make them. So again, even last week, I had a conversation with a lady who I was like, okay, you like to wear these shoes with a small heel, but there's like zero support in them. And she actually fell and actually came in to see me as a result of a fall in the church last year and suffering, from knee pain as a result. And I was like, okay, so these shoes have zero support that you're going to continue wearing them, at least consider getting orthotics. And obviously we worked on her knees, et cetera, et cetera. So, and that can help them feel more supported at least that way. But I
Well,
still have a conversation about like, hey, you need to open up your mind and wear maybe a more fashionable sneaker if you know something. So I try to to kind of keep in mind and consider the individual's preferences, right? I mean, we all people, and what works for one person doesn't work for someone else. So I try to consider all those kind of things that, okay, this person maybe we'll be open if the sneaker is a little bit more fashionable rather than a regular, I don't know, New Balance, walking shoe. So
yeah, very good point. Well, we're almost at the top of the hour here. So, could you kind of just reflecting on what you covered, you shared a lot of wonderful information with all of us. What are key three key takeaways that you want people who are watching this to kind of really gain from your presentation today?
So the three key takeaways. So by all means, evaluate your space at home, right? Your living space, your bathroom, your outside space, if you have a yard, whatever, right? So I went through the checklist. That's the first thing, by all means. Second is, yes, come see a chiropractor. Get your feet checked, get your ankles checked, get your spine, your legs checked, because we want, you to feel more, stronger, more stable, more coordinated. That's a big part of it. Even if you don't want to necessarily come in for chiropractic care because you don't have any back pain and you don't think it's necessary, at least get your feet looked at, have your shoes looked at, consider changing that. And third is proper nutrition and hydration, right? They're very important. So that way, you take care of your actual bones, right? So for this whole osteopenia, osteoporosis, situation, that yes, make sure that you can get adequate calcium and vitamin D and other nutrients, so that way, your bones don't lose all that calcium rapidly as you age.
Mhm. Very good, very good. So just the second point that you made, as far as footwear goes, does every chiropractic office, do they have what you offer as far as the, evaluating a person for proper footwear and the inserts and recommendations? Do every clinic, chiropractic clinic have that, or it's just certain ones, right? So if people are interested, they just need to make sure that that office offers what you're talking about. Very good.
Correct. Yes,
Okay.
not every chiropractor does this. Not every, it's based on their own individual interests and philosophies. Happened to get into it, many years ago, because patients would come in with lower back issues and their lower back issues weren't clearing up, and a lot of times it was because of their feet. So when I started looking at their feet and addressing their feet, and clearing up those lower, stubborn back problems, so that's how I got into it many years ago, and that's why I look at it at everyone's feet. And Dr. Ann Doggett, the owner of Whole Body Solutions, does the same thing. So not every office does that. So Whole Body Solutions, for example, does that. But yes, if you call a chiropractor and this is what you're interested in, you can ask them like, hey, do you guys look at feet? Do you screen for orthotics? Do you have a machine? How do you check? See what they say, yes or no. If they say no, then no. And if they say yes, great.
Those inserts, are they covered by insurance, or how does that work for people, especially older adults who might be, listening to this and might be interested?
So unfortunately, it is an out-of-pocket expense, okay, because they're made to your feet. They're not super cheap like Dr. Scholl's. But price wise, they range between $300 and $400 for a pair, depending on the type one gets for the type of footwear that they're interested in. But honestly, it's a great investment in my opinion. And I'm not saying it because I'm a chiropractor, but I have them. My family has them. I mean, I've done so many pairs. The results are tremendous, and satisfaction rate is also very high. I would say in all the 18 years that I've been doing them, I've returned, and I do like about 40, 50 pairs a year. And I return maybe like 10 pairs or even less in like 18 years from all the hundreds of pairs that I've done because people love them and they see a difference. So it's, money well worth spent. So yes, and that's why it's better to take that money that you would spend on Dr. Scholl's, set it aside, save up for something much better for you.
Great. And does it require any special care at all? Does it need to be washed or anything like that? Or
No, honestly, it's really straightforward. You don't do anything to them. You just stick them in and you wear them. If for some reason, someone has really sweaty feet, you can take them out at night, air them out, or stick those little, those moisture wicking balls that they sell for the shoes, and that's it. Don't wipe them, don't wash them, don't dry them, don't do anything to them.
thank you so much. And I also want to thank the Quincy Health Department for continuing to sponsor the Aging Strong program. So until next time, everybody, have a great day, stay safe, and be well.